The purpose of basic first aid is to provide immediate care to an injured or ill person until professional medical help arrives. It aims to 1. Preserve life. 2. Prevent the condition from worsening. 3. Promote recovery. 4. Relieve pain and discomfort. 5. Protect the casualty from further injury. 6. Ensure a safe and effective response during emergencies. 7. Minimize long-term effects. 8. Facilitate professional medical care. Basic first aid can make a significant difference in improving outcomes and saving lives. The ABC of emergency first aid serve as a critical framework for determining the severity of the situation and taking appropriate action. They are often used in situations where a person's life may be at risk, such as cardiac arrest, choking, or severe trauma. The ABC are A. Airway. Ensure the casualty's airway is open and clear of any obstruction so air can pass freely. B. Breathing. Check if the casualty is breathing normally. If not, provide rescue breaths and begin CPR if required. C. Circulation. Check for signs of circulation, such as movement, responsiveness, or severe bleeding. Control bleeding and continue CPR if necessary. The ABC approach helps first aiders identify and treat life-threatening conditions quickly and effectively. A basic first aid provider is responsible for giving immediate care to an injured or ill person to preserve life, prevent the condition from worsening, and promote recovery until professional medical help arrives. Scope of practice: assess the scene and ensure safety. Perform primary and secondary patient assessments. Provide basic life support, including CPR and rescue breathing. Control bleeding and manage shock. Assist with fractures, burns, wounds, and other common injuries. Monitor and reassure the patient. Activate emergency medical services when needed. Record and report incidents according to organizational procedures. A first aider must work within their level of training and not perform advanced medical procedures beyond their competence. When providing first aid, you are operating at the intersection of immediate medical care, ethics, and the law. Navigating this successfully means balancing the urgent need to help with respect for the casualty's rights and your own legal protection. Here is a summary of the core ethical and legal principles every first aider needs to know. Legal principles: duty and protection. Legal frameworks vary by region, but 3 primary concepts govern a first aider's liability. 1. Duty of care. A duty of care is a legal obligation to provide assistance. The general public. In most jurisdictions, including South Africa and the US, a bystander has no automatic legal duty to step in and provide first aid to a stranger. You cannot be sued simply for walking away. Exceptions. You do have a duty of care if you have a specific workplace role, for example, a designated occupational health and safety officer. You are a parent or guardian. You directly cause the accident or situation. You have already initiated first aid. Once you start, you have established a duty of care and cannot abandon the casualty. 2. Standard of care and negligence. Once you begin treatment, you must provide a standard of care appropriate to your level of training. Negligence occurs if you cause further harm by acting far outside what a reasonable person with your training would do, or by attempting procedures you are not qualified to perform, for example, attempting a tracheotomy based on a TV show. The golden rule: only practice what you have been trained to do. 3. Good Samaritan. Protections. Many countries have legal protections designed to encourage bystanders to help. If you act in good faith, within the scope of your training, without commercial motivation, not charging for your help, and without gross negligence, these laws generally protect you from being held legally liable if the outcome is poor. Ethical principles: rights and respect. Ethical principles focus on how you treat the individual, ensuring their dignity and autonomy are respected during a crisis. 1. Consent, the most critical step. You must always obtain permission before touching or treating a casualty. Touching someone without consent can technically be viewed as assault. Informed/expressed consent. If the casualty is conscious and alert, introduce yourself, state your training level, ask if you can help, and explain what you plan to do. They must explicitly agree. Implied consent. If the casualty is unconscious, confused, seriously injured, or unable to communicate, the law implies that they would want life-saving help. You can legally proceed with first aid. Minors. If a child needs help, seek consent from a parent or guardian first. If no guardian is present and the injury is life-threatening, implied consent applies. Right to refusal. A conscious, competent adult has the absolute right to refuse care, even if that choice seems irrational or life-threatening to you. If they say no, step back, call emergency services, and monitor them from a safe distance. 2. Confidentiality. Any personal or medical information you learn while treating a casualty is private. You should only share details about the casualty's condition, history, or treatment with arriving professional medical personnel, paramedics, doctors, or relevant workplace safety authorities. Avoid gossiping about the incident with colleagues or posting details on social media. 3. Abandonment. Once you commit to helping a casualty, you cannot leave them until someone with equal or higher training takes over, such as paramedics, a doctor, or another qualified first aider. Or if the scene becomes physically unsafe for you to stay. Leaving an unstable casualty unattended before help arrives is considered abandonment.